Hello everyone, this is Dr Vikrant Shah, a physician, intensivist and infection diseases specialist from Zen Hospital, Chembur. Here I am today. It's my pleasure to talk to you all on the World Hypertension Day. We all know how important hypertension is and how bad it can be. So all the chronic diseases like hypertension and diabetes affects your major vessels and minor vessels, what we call it as macrovascular damage and microvascular damage. You can have heart attack, you can have stroke, you can have conditions like peripheral neuropathy, you can have retinopathy and nephropathy wherein your eye can get involved, your kidneys can get involved. So we need to be very cautious, and it is a very important thing to understand the importance of having the lifestyle modification in our day-to-day life, and that takes care of most of the chronic diseases. So what is hypertension? So any blood pressure persistently recorded by a clinician and systolic blood pressure persistently remaining above 140 and diastolic above 90 millimeters of mercury defined as hypertension. So it could be of two types, primary hypertension and secondary hypertension. Primary hypertension, which is seen as a part of heredity, stress. Secondary hypertension, wherein there is some other organ which is involved, like thyroid, like kidneys, like suprarenal gland, sometimes hormonal. So all these conditions has to be diagnosed by your doctor. And what is imperative? To have a stricter control on your diet and regular exercise. So healthy diet is what is going to be the goal for therapy. You will be surprised to know that just exercise 3 to 4 times in a week can bring your blood pressure by 8 by 5 millimeters of mercury. So 8 is systolic, 5 is diastolic. So if you have mild hypertension, just a good lifestyle in the form of healthy diet and exercise can bring your blood pressure down. So what do I mean by diet for hypertension? So it should be low salt diet. There should not be excess salt in any of the food ingredient. There should not be table salt, and things like papad, pickles, chutneys wherein there is extra salt which has been put as a part of preservative should be avoided. So regular 3 to 4 times of brisk walking in a week. Aim for around 16 kilometers a week or 3 kilometers per day. If you are into walking, if you are into swimming, half an hour swimming every day. If you are into gymming, then around 20 minutes of treadmill, 10 minutes of cross train or 10 minutes of cycle should suffice. So absolutely what is important to know that all these chronic conditions like hypertension and diabetes leads to a condition called as atherosclerosis, and that leads to your vascular compromise leading to heart attack, leading to stroke, what we call it as paralysis. So we don't want this to happen. We want healthy life. And what is the definition of health? Health is a definition which is labeled as complete well-being of physical, mental, social and psychosocial well-being. So it will not be achieved unless and until you keep yourself fit. And fit has to be mentally fit has to be physically fit. So get into regular exercise, get into a proper diet regimen and give importance to your life. So love yourself and be aware about hypertension, what we are celebrating the World Hypertension Day. Thank you very much.